Dr. Corey Maas on Looking Your Best. Today I want to talk a little bit about Kybella. Kybella is deoxycholate, approved in the last couple months by the FDA, and it's a drug that is injected specifically as approved into the fat in the neck, and it causes the rupture of the fat cells or dissolution of the fat, ultimately losing that fat that's under the neck. And there is a skin tightening effect as a result of the inflammation that gives contour back to the neck. And so it's non-surgical, easy way to improve neck laxity and neck fat. It's very exciting. A lot of people are asking me questions about it. One of the main questions I get is, as a principal investigator in the study that led to its approval, and we've done now over 300 treatments with the drug, is what are the complications or side effects? Side effects are easy. People can get swelling, but in contrast to what I've seen written or talked about online, not everyone gets dramatic swelling or this bullfrog-like type of swelling. That's more rare. In our experience, probably 1 in 20 patients get that at the most. Maybe 1 in 15 would be the highest number that I would expect to see it. Everybody gets a little bit of swelling, but dramatic swelling was rare in our experience, both in the study and subsequently. So that's a side effect that everybody could expect, is swelling. And I think that with the study, we were unable to use any kind of compression garments. We'll be using a little chin wrap that's elastic and it's got a little Velcro attachment on it that can be taken on and off. Just a little compression will really change the trajectory of that side effect to recovery. The other ones are on complications, and there are 2 main ones that we think about that we're seeing. I didn't have any of these at my site, but we know that they do happen from experience at other the research sites for the approval. One is an inflammation of the nerve when it's injected too close to the marginal mandibular nerve, which is the small nerve that runs right under the chin here and supplies the lower lip muscles that can give you lip asymmetry if inflammation or neuritis is caused around the nerve. This is really about the doctor understanding the anatomy and avoiding that area so that there's no injection of the deoxycholate right over the nerve. Simple to do that, avoid the nerve if the doctor understands the anatomy, and it's not something that we would expect to see. But if one gets it, so far no one's had a permanent nerve injury or weakness or any long-term side effects. It's always been temporary in the other sites that have reported it. The other important one is that when the drug is injected too superficially, rather than in the fat, but in the skin, there's a chance that the skin can have an ulcer or sore that's created there. We obviously don't want any kind of skin issue happening, and so again, it's up to the doctor to assure that it's injected into the right place, into the fat that we're trying to treat. And if it's done that in the right place, the chance of skin ulcer or sores underneath in the area that it's treated are almost 0. We saw 0 in our experience now, like I said, over 300 treatments, so I don't expect to see any of that in the practice. Obviously things heal, but that's something we want to avoid. Those are the main things that we know about Kybella, and our experience is pretty great. The study was very well conducted, and it's exciting now that Allergan's taken over. They will obviously do a good job on education and training for the new physicians. I'm already training physicians here in my office on its use. So it's exciting, and there's a lot of enthusiasm about it. A good non-surgical alternative to improve neck contour by removing fat and doing skin tightening with a simple injection. If you have any other questions, don't hesitate to contact me. Reach out to drmaas.com or even our website at maasclinic.com, and we can answer those for you. This is Dr. Corey Maas on Looking Your Best.